We did have some discussions about this, and I can't say all the details, but we understand that Canada is having ongoing discussions with our neighbours to the south, with the United States, as they are updating and revising their border measures. So I expect we will hear more about that in the coming days. People from BC do go to Mexico quite a bit, and myself, I'd be running away to the Caribbean if I could, but that's not in the possibility this year. So yes, I think there's more discussions happening, and I expect we'll hear more.
Richard, do you have a follow-up?
I do. Now that we're at the point where everyone in long-term care has been offered the vaccine, is the idea of any semblance of rapid testing for long-term care staff out the door? I know this has been a debate and you field these questions a number of times, but is this no longer up for discussion considering we're getting to the point of full vaccination in long-term care?
Yeah, so I think my views on using rapid testing in long-term care have been expressed by others as being dichotomous, and I will say we are using rapid tests in long-term care and have been. We've been using them in the downtown east side, in shelters, in correctional facilities, in communities, in residences, in every place that we think they may be of value. And yes, we've done, when we have outbreaks in particular, and for many months it's been part of the routine that we have testing of all staff and residents on a regular basis. And in some instances, we use the rapid test for doing that in between times, for staff in particular, sometimes for residents. So I absolutely am looking at every possible use of these rapid tests. But I will also say that they're not simple. They're not. They do take resources, and they take commitment from staff and from the facilities themselves. And the pilots that were done in 5 long-term care homes in Vancouver Coastal really showed that you really had to have staff resources from the facility as well as medical staff resources, and we can train people like medical students and nursing students and others to do it, but you have to find them as well. And right now, our focus has been on supporting staff in an outbreak. It's such a challenging situation, and we know that staff shortages and people coming into work to support each other has been a large part of that. So it's part of a many different pronged approach to long-term care, and absolutely immunization has been the single most important thing that has helped us right now. Whether we use rapid testing in areas where access to the gold standard is not as timely, that will continue, but we will continue to use the gold standard PCR testing where our turnaround times are very short in most places. So, I think what has been expressed, including in your paper around COVID-0, is likely not a reality for a jurisdiction such as ours, where we have so many land borders and ways that people move in and out through this province. Particularly, our biggest risk continues to be from the United States, and the people who move back and forth across our borders from the U.S. And that is a reality of where we are geographically in the world and where we are in our social economic interactions in the world. It's nice, and I know here on Vancouver Island, people could see a vision of wrapping ourselves in shrink wrap and not letting anybody in, but that again is not realistic in our context. We have so much essential travel. I think about this past winter, or I guess it was before the pandemic, and we had a couple of days of really bad windstorms where the ferries couldn't come to Vancouver Island, and grocery stores were running out of groceries. We are that dependent on movement of goods and services across our borders that I don't believe the New Zealand model of COVID-0 is achievable in this province. Obviously, we want to get this as low as we possibly can, particularly in people who are most at risk of either working in or being vulnerable to severe infections and hospitalization and death. And as I mentioned earlier, the more transmission you have, the more likely it's going to be somebody is going to have a more severe illness, even a young person. And the more the virus can replicate, the more chances are we're going to get another variant or mutation that's going to have some advantage and give that virus a chance to spread more widely. So our goal is to minimize morbidity and mortality. That's the important part. And to do that, we need to minimize transmission as well.
Thank you. And we have time for one more question this afternoon for everyone listening today. There will be a statement released this afternoon with the latest information on cases, hospitalizations and outbreaks, which you can find at news.gov.bc.ca. For medical guidance on protecting families and communities, and for access to provincial guidance on COVID-19, do visit bccdc.ca. For information about the province's pandemic supports, visit gov.bc.ca/COVID-19. And the last question this afternoon comes from Susie De Silva, CBC.
Thank you very much. Dr. Henry, can you give us a breakdown of where exactly the cases are occurring, sort of with the data to back it up? For instance, are we talking about 75% of the cases that we're seeing happening in workplaces? Are we talking about 50% from small group gatherings at home? All this week we've heard a lot about doing more, and speaking to a lot of people, they say if they understood exactly where this was happening, it would help them to do more. So can you break it down with some data in terms of where we are seeing these cases? And if you're not doing that, can you explain why not?
Yes, well, we've tried to do this multiple times, but it is not that simple. And you will have remembered that I presented a number of scenarios where somebody transmitted in a gym, and then one person went to a wedding and it transmitted to X number of people. So I can tell you that about 30%, 40% of the cases we are seeing right now are related to workplaces. But what does that tell you? It tells you that it's not so much the public interface. So we're not seeing it in people who are shopping at Costco. What we are seeing it is in people who are working together. And so we have been, as I've said many times, been working with WorkSafe to enhance the guidance, to go in and to do inspections, to do investigations where we're seeing workplace transmission. So we see, for example, a number of food processing plants where we've had high numbers of people. So when you talk about, the percentages, it's not that simple either, because you could have a large outbreak in a food processing plant, or we can have a small one that's caught early, and it's still, the risk is the same. So what we've been telling people, these are the situations where we are seeing transmission. We were seeing a lot of transmission. About a third of it was from social events, including weddings, birthday parties, all of the different social occasions that we have together. And when we put in the event restriction order, those have gone down. But we are continuing to see clusters, small numbers of people that are transmitting, and then it spills over into the workplace. It spills over into a long-term care home, because I went to a birthday party with 6 people, and those 6 people worked in 3 different places. So it's really challenging to try and say it's exactly this or it's exactly that. These are all interconnected and interrelated. Where we are seeing transmission now are in small social gatherings, in places like Fernie, in places like around Williams Lake, in places like Whistler. We see them when people have people over to their house. We see them when people are living in group accommodations. And so it transmits in those environments. We see it in workplaces as well, in many different settings in the workplace, not necessarily at the public interface, but it's when we're in meetings together, not wearing masks in crowded conditions, having lunches in lunchrooms, having breaks together. Those, unfortunately, are situations where the virus can transmit more easily.
Do you have a follow-up, Susie?
Yeah, we understand that there was a vaccination clinic taking place on the downtown east side today. I'm just wondering if that means we're a bit ahead in the rollout plan. I know it said February. I know we're only a few days away, but does that mean we're a bit ahead despite the supply issues that we've had? And can we get the answer in French, please?
Sure. No, the issues that we're seeing in the downtown east side are related to what I just mentioned a few minutes ago about shelters. So we are seeing outbreaks in people who are underhoused and homeless in the downtown east side, and also in areas of Fraser Health and Surrey in particular. So this clinic is to try and address some of those more at-risk people who live and in the downtown east side neighborhood. It's also what we're finding is that it's related to the outbreaks at St. Paul's and in facilities in the Fraser Valley as well, or in the Fraser Health Authority as well, because people who live in the downtown east side, when they get sick, they often go in to St. Paul's. So it is trying to address the outbreaks and clusters that we're seeing in those communities. And before I turn it over to Minister Dix, I did want to make one other thing clear. It was a question that came in about whether I have received my second dose of vaccine, and the answer is no, I have not. I absolutely believe in the data that we have that shows that extending the interval between dose 1 and dose 2 is not only safe, but there's a very real probability that it will provide more durable and longer lasting protection. So I will be waiting until there's sufficient vaccine available later on in the spring.
Oui, aux régions du centre-ville de Vancouver à l'est, il y a des cliniques actuellement. Il y a des gens qui vivent ensemble, effectivement, dans les abris dans la région, qui ont besoin de protection, et surtout parce que cela a un effet évident sur l'hôpital Saint-Paul. C'est important de faire. Ça fait partie de notre plan dès le commencement. C'est de répondre aux questions urgentes, dans notre plan de vaccination, mais aussi de vacciner des gens surtout dans le domaine de la santé qui sont essentiels et où la vaccination est nécessaire. Donc, on a mis l'accent sur le secteur de long-term care, mais il y a aussi des régions et des endroits dans les régions qui ont besoin d'aide actuellement. Donc, on a tout petit peu de vaccins actuellement et on va l'utiliser d'une manière stratégique pour limiter la transmission, surtout pour ceux qui sont les plus vulnérables. Merci beaucoup. Thank you very much. We'll see you on Monday.